Rotator cuff surgery is one of the most common orthopedic surgeries done. It is also one of the most excessively done. I'm going to talk about when it is indicated and when it should not be done.
Before we get into it, for anyone watching for the first time, can you introduce yourself?
Sure. I'm Dr. Leon Popovitz. I'm a board-certified orthopedic surgeon and co-founder of New York Bone and Joint Specialists. I've been in practice for over 20 years. I've been one of the team physicians for the U.S. Open Tennis Championships, and I specialize primarily in sports medicine and in the treatment of the knee and shoulder. My treatment philosophy is preservation is the key to longevity. So surgery is only the absolute last resort unless it's the only option to preserve that joint.
What does asymptomatic tear mean, and how common is that?
Asymptomatic tears can be relatively common. For example, if an MRI was done on the shoulder for some other reason outside of looking for or suspecting a rotator cuff tear, and then we find the tear and say it's partial thickness and there's no symptoms, then we monitor it. Or if we see someone that presents with symptoms with no weakness and we treat them conservatively and their pain resolves and there's no weakness, that turns into an asymptomatic tear. We monitor that. But you want to closely monitor it to make sure that it doesn't turn into a full tear, or if it is already a full tear, it doesn't start retracting. Once you start seeing it retracting or propagating or turning into a full tear, that's already giving us the signs that this type of tear is not going to stay calm. And then you start thinking, well, to preserve that joint, we're going to need to probably repair that tendon before it gets irreparable. And that does occur with rotator cuff tears. If the rotator cuff tears are neglected, they become irreparable. The atrophy goes too far. There's too much fat that the tendons turn into. There's nothing there to repair anymore. So we have to closely monitor tears, period.
Who is the patient who doesn't need surgery, even with a significant tear?
So usually older patients that do not have a lot of physical demand and have no significant weakness and are managed well with conservative treatment. Totally monitor those patients and watch those patients, especially if their tear is only partial. Those are the patients you can and you should monitor and not rush into surgery. Other treatment options include regenerative medicine, especially for partial tears or small tears. We're seeing amazing results with that by using plasma treatment, where we simply just draw your blood in the office, spin it, concentrate it, and use the healing plasma to focus on healing the partial tear or the small tear, or even turbo boosting the effects with using stem cells, where we can draw the bone marrow from your hip joint and hip bone rather, and inject that after spinning it. That is just super powerful healing tissue without surgery.
How do you have the conversation with someone who comes in expecting to be told they need surgery?
I'm very honest with every patient. I give them all the options, all the circumstances, and ultimately we decide together whether the patient has surgery or not. These sort of decisions always have to be together.
Do patients ever push back on a non-surgical recommendation?
Sure. Yeah, but it's my responsibility to be honest and open and give the patient all the details. Just because a patient wants surgery does not mean a surgeon should rush to the operating room.
What is the follow-up plan for someone you treat non-operatively?
So if the patient comes in with no significant weakness and no trauma, and we find, say, a partial tear, or even a small full-thickness tear but no weakness, we can try some physical therapy for 6 weeks and follow up in 6 weeks. If the pain is still there and the patient doesn't want surgery, you can try a cortisone injection. You don't want to do more than 1 or 2 cortisone injections in any particular joint in 1 year. So each joint, you don't want to do more than 1 or 2 injections per year. The other thing is if you give them too many cortisone injections, then it affects the healing if ultimately surgery is necessary. If the patient's symptoms resolve, then we continue to monitor them. So let's say that patient resolved after the second visit cortisone injection and came back again a month later after another month of physical therapy and said, I'm feeling much better. move my arm, I'm doing okay. To go continue doing your home exercises. See me back in 3 to 6 months, see how you're doing. If the pain returns sooner, come back sooner. And then we continue to do that, and then we can start like maybe increasing the time we see each other to 6 months to a year. The patient continues to do well, but as long as the patient knows that if the symptoms return, come back sooner. For patients with acute traumatic tears who are younger and have weakness, to be frank, acute traumatic tear in someone who's very young and has weakness, more often than not, really requires prompt surgical treatment before that tendon retracts and symptoms get worse. You can try a few weeks of conservative treatment to monitor it and see, but you got to monitor that very, very closely, make sure it doesn't get worse.
What does failed conservative treatment mean? How long do you try before recommending surgery?
So for a degenerative partial tear or a small tear with no weakness in an older patient, you could try a few months. You could try, usually I have them come back in 6 weeks. We reevaluate, may try another option, may try cortisone injection, may try PRP injections, home exercise. You could try it 3 to 6 months to monitor. May not, if they develop weakness, I wouldn't rush, I wouldn't wait 6 months necessarily. But if their strength is holding on and their symptoms are tolerable, you could try a few months of conservative treatment before making a decision. And if it helps, then wonderful, then we continue to monitor it. For someone who's young with an acute traumatic tear, you got to keep a very close eye. Try a month of physical therapy, follow up in a month. If they prefer conservative treatment, I would say follow up after a month of physical therapy and see. But a discussion, that's one of those situations where sometimes the conservative route is actually the surgery, and sometimes that's a situation where surgery actually is the only or primary direction to preserve that joint. And by avoiding surgery, you end up actually causing harm.
What does a proper conservative program include that most patients aren't getting?
So the physical therapy is absolutely crucial to the conservative treatment because it combines focusing on strengthening the joint and flexibility. A lot of people, when their shoulder hurts, they tend to kind of contract and not move it. And if it hurts when you raise your arm, you mentally think, okay, then I won't raise my arm. But the problem is it gets stiff and scar tissue sets in. And then you get something called a frozen shoulder. And that's when the capsule around the joint gets stiff. It adheses to the actual joint itself. And the frozen shoulder starts creating significant pain and limited motion. And then you have a second problem. So you want to avoid that. That's why physical therapy is absolutely crucial for someone with a rotator cuff tear. You want to make sure that joint is flexible and moving. And then it's also crucial for the patients to do their exercises at home. Can't go to physical therapy every day. It's not practical. So you want to do the exercises at home, and I recommend those exercises to be done twice a day, morning when you get up and at night before you go to bed.
What mistake do patients make during conservative treatment that prevents improvement?
Limiting their motion. So a lot of patients think, okay, you're just going to go to physical therapy twice a week and see how things go after a month. There's a lot of due diligence, there's a lot of dedication that the patient has to take on to make sure they don't get stiff, to make sure they regain their strength. So they have to do the home exercises at home. It's not just a matter of just going to PT twice a week and hoping that's just going to do the trick. There's a lot of homework, a lot of work at home. So that we can help more people and reach more people, please be sure to like our video and subscribe to this channel. Thank you so much.